Good day guys, we're going to do our assessment of the abdominal area. Just to give you a background of my patient, I don't have an actual patient right now, but my patient is a 24-year-old male. He has an active lifestyle and I have already gathered his subjective data. So let's go with the current symptoms. My patient has no history of abdominal pain. There's no precipitating factors that makes the pain worse. Since there's no pain to begin with, we could not pinpoint the location of the pain since he is not complaining of any pain. There is no symptoms regarding changes in taste. There is no nausea, no vomiting, no change in appetite, and no diarrhea and constipation. The patient is weighing 60 kilograms right now, and he reports that he has been with that weight ever since. Let's go to the past history of the patient. My patient has no history of surgery, trauma, injury, and taking of medications. For the abdominal pain, there is no pain, so there is no treatment. He has not undergone any laboratory test and works for gastrointestinal studies like colonoscopy, duodenoscopy, ultrasound, CT scan, or chest x-ray of the abdomen. We go to the family history for the patient. There is no history of stomach, colon, liver, cancer for the patient as he has stated. The abdominal pain is not present, so he denies any appendicitis, colitis, bleeding, hemorrhoids. And for the person responsible for preparing the meals for their family, he reports that his mother is preparing the food for them. He is on a plant-based diet, practicing since 3 months ago. Starting the pandemic, he tried plant-based diet. So for the lifestyle of the patient, the smoking, alcohol consumption is none because he is not smoking or drinking. For the past 24 hours, his food scheduling is oatmeal during the morning, followed by a glass of water, wheat bread in lunch, and a little bit of apple and fruits in the evening. Then, for the medications, he is not using any antacids or any suppressive meds for acidity. For the fluid intake, he claims having 8 to 10 glasses of water or more. Since it's summertime right now, his consumption of water is larger than expected. The exercise for the patient, he claims that the activity of exercise is decreased, especially after the general community quarantine, where the limitation of going outside is really hard, especially if it's not essential. So the exercise, he claims it to have 30 minutes a day. So for my patient, he is currently enrolled in online school. The stress for him is the passing of requirements and beating of the deadlines. But aside from that, he claims no other source of stress and problem. There is no past action for the abdominal pain or problem since there is none to begin with. So this ends our gathering of subjective data. We would be proceeding now to the objective data gathering. We're going to gather the objective data. So I am here with my patient. I've just modified my setup. I don't still have a patient with me right now, a live patient. That's why I'm using a dummy for our abdominal assessment. What are we going to do? We're going to gather the equipments that we will be needing, or equipment that we will be needing. First is the pillow, next is the towel, a marker pen, also a stethoscope, and a centimeter ruler. Okay, after gathering the equipments, let's explain the procedure and ask the client to put on a gown. So, good morning, sir. Good day, sir. I'm your nurse, Val, and I would be doing abdominal assessment. The purpose for this is to have a baseline for your chart. Is it okay? The patient says okay, and the patient is already in a gown. Okay, so the next thing that we're going to do is we're going to inspect the skin color. So I'm just going to raise her gown, and I'll use this towel so that you won't be exposed. Okay, so for my patient's skin color, It's a little bit light from the overall complexion of the skin, which is flesh or light in complexion. Okay, so for the vascularity, there is no vascularities seen or noted. Okay, so for the stray, there is no, for example, there is minimal stretch marks noted here in the lower abdomen due to loss of weight. There are no scars noted and no lesions upon assessment. Okay. So next thing we're going to do is inspect the umbilical area. This patient does not have an umbilical area, so shifting to close. Okay, I would be using this baby for assessment of the umbilical area for discussion purposes. Let me just cover the face so it won't be disturbing as well. Okay, there we go. Okay, so for the so I've set up my patient and I'm now going to assess the umbilical area of the patient. So right side of the patient. Okay, so my patient's umbilical area, it's evenly colored. The location of the umbilical area is in the middle. Okay, and the contour is protruding, and it protrudes using the ruler at least 0.5 centimeters, so it's within the normal range. Okay, so next what I'm going to assess is the contour of the abdomen. Okay, so upon assessment of the abdomen of my patient, it's more of flat and rounded at the same time. Okay, as well here, it's noted to have symmetrical features in shape. The umbilical area is in the midline and are equal on assessment on both sides. Okay, for the patient. Okay, so let me check for the aortic pulses or peristaltic wave. So I'll be shifting back to this big mannequin. Okay. Okay, so my patient has a bounding part on the aortic area. It's a little bit visible. Peristaltic wave is not present in my patient as well upon checking. Okay, so now let me move to the next part. Sir, I'm just going to auscultate your abdomen. Okay, with the use of the stethoscope. Don't forget to warm the bell of your stethoscope prior to auscultation. I mean the diaphragm of your stethoscope prior to. So we'll be doing it in quadrants. Okay, and listen for vowel sounds. Sir, was there any pain while I did the auscultation? So the patient replies no. Okay, upon auscultation, there is normoactive vowel sounds. I was hearing approximately 20 gargles or clicks during the said procedure. So sir, now I'm going to auscultate for your vascular sounds using the bell of my stethoscope. Also, I would be assessing over your liver and spleen. Okay. So let me start, sir, with your hepatic area. And your splenic area. Now, sir, I'm going to proceed to your aortic area. I would be checking, sir, both of your renal arteries. I'd be just checking, sir, for your venous hum right here. Okay, since my patient doesn't have femoral arteries or iliac arteries, let me just use the baby for visualization. Okay, sir, I'm just going to check your iliac arteries. Okay. And let me go to the femoral part. Okay, so we're done with the assessment. So upon assessment, there are no friction rubs over the hepatic and splenic area. There is no bruit noted over all the arteries that we have assessed. Okay, now we're going to do the percussion. Okay, so first we're going to palpate for we're going to percuss. What I mean for the percussion over the lung, over the abdominal area. Okay. Over the umbilical area. Okay, so findings are there are dull percussion over solid areas, which is the liver and spleen. Now, sir, I'm going to do our scratch test for the liver after percussion. Okay. So what I'm going to do is I'm going to do a scratching motion up above, and I'll try to determine the borders of your liver. Okay. I'll just be placing the stethoscope above your, just below the sternal area. Okay. While I'm doing the scratch test. Okay. So start at position 1. Okay. Okay, the sound is loud here. Let me just get my marker. I would just be marking it here. Remember the mid-clavicular line. Okay, so this is the clavicle. It's mid-clavicular. Okay, let me mark it there. So let me just continue with the scratch test, sir. Okay, the loud sound ends here and does not progress. Sorry, sir, if it's a little bit ticklish. Let me just mark it here. Let me just get my ruler. So upon measuring the mid-intercostal space for the liver span, it is 7 centimeters, which is within the normal range of 6 to 12. Okay. So, sir, now I'm just going to perform the percussion, the blunt percussion of both over your liver and kidneys. But I have to instruct you, sir, that you would be sitting down. Okay. And then I'll be eliciting a blunt force over your back, over the kidneys and your liver. Okay. So, let me just assist you to get up. Okay. For example, your client is already sitting down since he is not having any feet. Okay, so try to palpate Okay, let me show it in another angle of the camera. Try to palpate where the liver is. For example, this is your liver. You have already palpated your liver. What you're going to do is place your non-dominant hand over the area and do a thud. Just one thud with not all of your strength or might. Okay, so there's the thud. Sir, were there any pain while I elicited the thud? Okay, the patient says no. So, sir, I'll be proceeding to the kidneys. Try to locate the kidneys. Okay, this is the patient's left kidney. So, put on mild pressure and then, okay, one thud. Does that hurt? No. I'll be just locating and palpating for your other kidney. Okay, for example, I've already located the kidney. What I'm going to do is place my hand over the area and then apply a thud. Okay, so did that hurt, sir? Okay, so there's no, upon inspection, sir, you could now lay down. Okay, thank you very much. Upon inspection, upon assessment for blunt force over the kidneys and the liver, the patient has no noted tenderness or pain upon application of the blunt force. Okay, we would be moving to the next step, which is the palpating portion. So, sir, we're almost halfway through. Okay, so I'm just going to do palpation of your abdominal area. Okay. So, sir, first I'm going to do light palpation and then followed by a deep or more intense palpation. Okay. Okay. Does this hurt, sir? No. How about this, sir? No. How about this area? No. How about this area, sir? No. Okay. So, sir, now I'm going to be applying a little bit of a deep pressure. I'll be doing it with both of my hands. Is there any pain? Sir, sorry, it's a little bit uncomfortable. Okay, no, sir. Any pain, sir? No. How about here? No. How about here, sir? No? Okay. So let me just go straight. I'll be also palpating your umbilical area. But since you don't have an umbilical area, let me shift to another sample or dummy. Okay. For example, this is the patient. Let me not expose him or her. Okay, so let me palpate the umbilical area. For palpation of your umbilical area, it's in a circular motion and around the umbilical area. Is there any pain? Okay. Okay, so there is no pain noted. Okay. Now, sir, I'm going to palpate your aorta. Okay, let me just remove this one. I'm just going to palpate the aorta. Okay, so I could use the two-hand technique for aorta palpation, or I could either use both of my hands to palpate for the aorta. Okay, is there any pain, sir? Okay, upon history checking, there's no sign for aortic aneurysm, so I'm doing this test. Okay, thank you very much. Okay, let me cover it again, sir. So, upon doing palpation for the quadrants, for both light and deep palpation as well as the umbilical and aortic palpation, there is no tenderness or pain upon palpation. There are no masses palpated during the said procedures, and there is no rebound or tenderness or pain felt upon inflicting the palpation. Okay. We would be moving to the next one, would be palpation of the liver. Okay, so sir, I would be using both of my hands to palpate your liver. Okay, so one of my hand would be on your back. Okay, let me just assist you there. Okay, and one would be palpating for your liver. Okay, Okay. Okay. Is there any pain? Okay, no. No tenderness, sir. Okay. Let me just palpate your spleen. Again, what I did with the other hand, I'll just be doing it with my non-dominant hand will go under you, sir. Just tell me if there is any pain. Okay. Sorry. The camera is not... Okay. Okay. Is there any pain or tenderness, sir? No. Okay. Let me just palpate, sir, your kidneys. Okay. I'll just be doing so here in the lower area. Okay. Is there any pain, sir? No. Okay. I'll just be doing the kidney on the other side. Okay. Okay. And last but not the least, I will be palpating for your urinary bladder. You have voided already earlier, but let me just check your bladder. Okay. So let me do a light palpation. Okay, thank you very much, sir. So upon doing palpation of the liver and spleen and the kidneys, those organs are non-palpable upon palpation. But the urinary bladder is a little bit distended because the patient had drank a lot of water prior to. Even if it's voiding, the patient notes that he has a little bit of urge on urination while doing the examination. Okay, so the urinary bladder is a little bit distended upon palpation. Okay, so we would be moving on for the next test, but the patient upon assessment has no ascites. So I would be skipping the shifting dullness. I would be also skipping the fluid wave test, and last but not the least, the ballotment test because of the absence of any ascites. Okay, so for now, sir, this is the second to the last series of examinations or tests. I would be trying to check for appendicitis signs. Okay, so the first one would be the rebound tenderness. Okay, sir, just tell me if there is pain. I would just be applying pressure in your right lower quadrant. Okay, sir, I'm pressing on it. I'll be releasing it. Okay, so my patient is negative for rebound tenderness. He has no pain upon releasing of pressure on the right lower quadrant. Sir, next what I'm going to do is we're going to do the Robsing sign. I'll just be applying pressure on the opposite side. Okay. Basically, students, if the patient is negative for one test, you could not proceed for the other examinations. But for demonstration purposes, I'll just be going on to the test. Sir, I'll just be placing pressure on the opposite side. Okay. Is there any pain? I'll be releasing it. No pain. Therefore, my patient is also negative for Robsing sign. The next procedure would... I am not able to identify the McBurney's point since there is no pain due to acute appendicitis. So, let me just demonstrate to you the SOA sign. So, let me just change patient because the patient doesn't have any legs. Okay. So, I'll just be exposing the part that is needed. Okay. I would be instructing you to lie on your left side. Okay. What I'm going to do now is I'm going to extend your leg and your hips. Okay. So, I could say that my patient is negative for SOA sign because the other leg remains straight upon the extension of the leg and the hip. Okay. So, let me just return to the... I'll be still using this patient. And the next test would be our obturator sign. Okay. So, I'm going to raise your right leg. Okay. And then, we will see if there is pain in your right lower quadrant. Okay? So, raise the right leg. Okay? And then try rotating it internally, the hip internally. Okay? Okay, so you can see it. The foot is up, and I'll try to rotate it internally. So the patient is not experiencing any pain. So therefore, I could say that there is no or negative sign for obturator test. Okay. The last test is the hypersensitivity test. I'll just be pinching because I don't have any sterile needle with me. Is there any pain here in your right lower quadrant upon lifting the skin fold? No. Therefore, I could say that the patient is also negative for the hypersensitivity test. Okay. So the last sign would be, or the last examination, sir, for today would be the Murphy sign for checking for cholecystitis. What I want you to do is exhale slowly. Okay. So exhale now. Okay, inhale. Okay, exhale. Thank you very much, sir. So upon eliciting the Murphy's procedure, or for the Murphy's sign, the patient has no stop or interruption in breathing and no catching while I pushed through the abdominal area to watch for any enlargement or inflammation of the gallbladder. Okay, so I was not also able to palpate the gallbladder, meaning that it is not enlarged or inflamed. Okay, so after that, I have done all of my skills or assessment. What I would do is assist the patient to a comfortable position, disinfect or wash my hands. Now I'm going to formulate nursing diagnosis, formulate collaborative problems, and last but not the least, make necessary referral and document it in the chart. So that ends the assessment for our objective data collection for the abdomen. I hope that you've learned something and have fun also as well as you do your return demonstration. God bless and goodbye.